Hello, everyone. Welcome to Ocean Rock Stars with Tom Neymat. Today we have a lovely guest, Allyson Pelletier. She is actually a licensed marriage and family therapist with lots of experience dealing with trauma and other related issues. And she's actually the clinical director for Ocean Rock Recovery, among other programs that we have. And she really has delved deep with both adolescents, youth, adults, and has tons of experience dealing with people really dealing with high intensity related issues. And so without further ado, Allyson, maybe talk a little bit about your background and experience, and then we can delve into the topics for today.
Yeah, perfect. Thank you for that introduction.
Yes.
So I've worked in high intensity, residentials, outpatients. It's basically all I've done. I started working my practicum at the Salvation Army,
Okay.
so substance abuse, addiction. I then went to work at a group home at Crittenton, and then from there I worked at some rehabs. I worked at Newport Academy with adolescents and families.
Got it.
So just, I've been all over the place, and now I'm at Ocean Rock, with the virtual program,
Yes.
Supervising, making sure clinical programming's good, and training the next therapists
Of tomorrow.
of tomorrow, whatever.
Right. Okay, no, that's great. And I mean, through all this experience, one of the things that we talked before the show, you were really, on a personal level and at a professional level, you were kind of delving really deep into trauma and how, how that's treated, and how it affects different ages and different populations. So I think one of the key topics for today is trauma. And I think a lot of people use that word, but really hearing it from a clinician and how it starts at childhood and how it could actually lead to mental health or substance abuse issues down the road. And then ultimately, whenever we have these conversations, we talk about, what we're talking about as far as the topic to educate the listener. But ultimately, we want to give them some tools and some, techniques that they can use at home. Obviously, if they need to have treatment and do further treatment, that's always an option. But at least let them know what are some things they can do at home and things to be watching for. So I think in this case, if we start with, what was your experience growing up, and have you had to deal with that on a personal level?
Yeah, so I mean, that's a great question. I got thrown into therapy from a trauma that happened when I was around 19. And my trauma was something that people couldn't really understand. They kind of blamed me for it. There were all these negative messages that got thrown at me that, I started to cope really badly. I started to self-harm. I was incredibly suicidal, had a suicide attempt, and was pushed into therapy. And luckily, my therapist kind of understood what was going on. It was the only person in my life that could wrap their head around it.
Right.
And so that's kind of what saved my life. And after that, I remember being in a psychology program, and they told you go interview someone. So I interviewed my therapist. And after hearing her interview, that's kind of what sparked me into like, wow, she's actually healing and helping people. Originally, I wanted to be like a homicide detective.
Big transition.
Yeah. So that geared me in the right direction to do my graduate program. And once I started to learn about like EMDR and trauma-focused therapy, I was like, that's my thing.
That's your niche, right?
Yeah.
Got it.
Because I had to go through it. I have done EMDR multiple times, and because of the work I did in EMDR, have been able to have a romantic relationship and all these things that I kind of didn't think I would have been capable of.
Wow.
So, yeah.
And I think that's, that just shows you, it started as a personal experience, but then it became a passion, and then, it became a career, right? And so, that's why you're so good at what you do, is because you have that ability to connect and relate to the clients and help them navigate these types of issues. A lot of people kind of bury these things deep inside. And so, you mentioned EMDR. I think we'll talk about that a little bit, later in the program, but really delving into what is EMDR, what does it stand for, what is that technique, because that's a tool and technique that is really useful in dealing with trauma. But before we get there, I wanted to talk a little bit further about just the educational component of trauma. I mean, what causes the trauma? What ages do you see, in practice of that kind of becoming an issue, and ultimately when people start developing these symptoms and addictions, how does that what's that process?
Yeah. So the DSM is really weird about their diagnosis of trauma. I don't necessarily, always agree with the DSM and how they categorize it, because they just categorize it as like a life-threatening event. However, chronic trauma looks like, being like emotional abuse and being told something over and over again, and then it being internalized, and then you're stuck with it. And you're like, how do I move forward with this belief about myself?
Right.
And so a lot of trauma really starts out in childhood in the way that our caregivers respond to us and respond to our needs. So, if they respond to us in a frightening way and scare us, then we learn that the person that's supposed to take care of me is dangerous and safe.
Got it.
So it causes what we call a disorganized attachment style. And disorganized attachment styles learn that the only way to cope is to basically dissociate or numb out. And a very, easy ways to numb out is substance abuse.
Right.
So,
and that's where the drugs come in.
So
or alcohol or whatever it is.
Yeah. So I'm a huge believer of trauma is the gateway drug to using substances. People don't pick up things, just because they're like, oh, I want to be a heroin addict. They do it because it's helping them.
Right.
It's calming their nervous system down. It's making them feel safe again. So a lot of trauma really stems from, our caregivers and how they treated us.
And so kind of going into that a little bit more, for the because we do a lot of education for parents.
Yeah.
And, there's no handbook on how to be a
Right.
parent. And a lot of times, as a parent myself, a lot of times at night you have all these ideas and, you think a certain way and then you wake up and everyone's screaming, especially if you have a few kids, right? And in the moment you might react a certain way. And so I think that's something I wanted to touch on is number one, what are the experiences somebody has growing up between the ages of, 0 to 4 and then afterwards, that ultimately gets stored in the body, this trauma that gets stored in the body that you might not even remember. I don't remember when I was 4 years old or 2 years old, and how that impacts their life. And then after we talk about that, I really wanted to touch on, how do you do that damage control, right? Like as a parent, you might in the moment say that something that you didn't want to say, but what do you do after that? Because a lot of times it's what we do is important, but what we do after what we do is also important. So why don't we start with just in that early childhood phase, what are things that you've seen and read and, both through education and experience of the damage that's caused?
Yeah. I have a story that's coming to my mind about, childhood's all about attunement. It's all about soothing to your kids and making sure that you can meet their needs.
Right.
Obviously, we're never going to be perfect. So they call it the good enough parent. But a story that comes to mind is, I had this kid who she had fallen and had hurt her ankle and she was crying out to mom, mom, come help me. And the mom's just like, oh, she's over-exaggerating, which was the typical kind of dynamic, And so the mom just threw an ice pack at her.
Fix this.
Here it is.
Here you go.
And later found out that her ankle was broken.
Wow.
And I remember having to do a family session and go hey, do you see what happened? She really just wanted you to come and be with her, instead of fixing it, just sit with her and soothe her because it's a kid. She doesn't know what's happening.
Right.
Probably terrified. Mother had such great intentions, right?
Sure.
And so then my job as the therapist is to kind of help the mom repair the situation. So yes, we mess up all the time as parents, right? It just happens. But the most important thing you can do is repair and say I'm so sorry. I did not realize your ankle was broken.
Right.
I should have been there. You're right.
Right.
I will do better. And that's what we need in every relationship. But something as small as that, if that happens over and over again, this child learns that what, I'm not important, no one cares about me, like they don't believe me. And so those get stored, and later, you know, this person becomes an adult, and that's how they interact with the world. Every interaction is like, they don't believe me. And there's
Right.
this, you know, guard. So it's going to impact all their relationships, their jobs, you know, everything. So that's just like one example.
That's one great. No, that's a great example. I think, you know, what about when you even go back further when, you know, you have a baby, right? When you have a baby, that's such a precious time, right? And so a lot of people, they're so anxious about that, especially if it's your first child. You know, you by the time you have your second and third, you're like, okay, I know what I'm doing. But that first child, or even, you know, just with any of your kids, there's all these different theories and different approaches. Oh, you should let them cry, and you should, you know, they should be sleeping on their own by the time they're, you know, a few months old or whatever. And there's a lot of different perspectives. You know, there's kind of the more traditional perspectives that are, you kind of soothe them, and you okay, if someone's crying, you go there and say, hey, what's wrong? And then there's the approach of like, well, then they're going to be attached to you and they're never going to be independent. And I think there's such a fear of this. They're not going to be independent when they're 18 if I treat them like this when they're 0. But based on what I've read, and, you know, I'd like to learn more from you, that's when they need you the most. And so can you share a little bit about what are some things that you've heard and seen parents doing that they thought was good, but based on both the studies and also based on all the experiences we have with clients, have actually been counterproductive?
Yeah, I mean, the example you brought up, which was like, you know, just let them cry it out, is a great example, you know, from ages 0 to, you know, 4, or, I mean, even later probably, like you know, the kid doesn't cry because, you know, of nothing. Like, it has a need, and, you know, the parent is supposed to attune to that need. So especially like that myth about like, just let the baby cry and go to sleep, you know, like, when attachment theory is, you have the baby's inside of you, it's attached to you, then it comes out. And so attachment theory is like, it stays with you, it learns to be away from you and come back, away from you, come back. And then as it ages, it can do more autonomy, but it always has this safe base to come back to. So if a parent's like, no, just leave him, like, you know, go be on your own, and the kid's like, where are you? Like, it develops this anxious attachment. And so that's where you see that needy, clingy feeling that parents are so afraid of, because a parent needs to be consistent and predictable to a kid, and know that you're always going to be there when I need you. Because without that, if, you know, then the kid believes like there's no safe person around. So
yeah, I mean, you go out in the world, and everyone is out for themselves, and you have all these different people, and, you know, whether it's work or school or whatever it is, right? And so you want to be able to come home and say, okay, this is my group that I feel safe with, right? And if you don't feel safe at home, then that trickles down into all the other relationships. And so, you know, now kind of moving forward, okay, you passed childhood, and let's say you've dealt with these types of issues, but then you didn't get that nurture. And maybe you did get it, but, you know, there's also parents who are busy. There's parents who, they think it's, you know, it's all about discipline. And there's parents who try their best, but you just, you know, it doesn't matter how wealthy you are, or so there's even parents who spend a lot of time with their kids, and during that time they do good things, but then they also do bad things. And so I think ultimately, you know, let's just say you're growing up, you're going in adolescence, you know, you're in your teen years. What have you seen in that age group of, you know, this trauma impacting relationships and then leading to potential mental health or substance abuse issues?
Yeah, I mean, I've seen a lot. Teens are very reactive. They're very fun. But yeah, I mean, just a lot of, they're very reactive. They have, you know, and with working with adolescents, you see all the behaviors. You see the self-harm, you see the suicidal thoughts, you see the drug use, and all of those symptoms or behaviors we look at as like, what else is going on? Like, why are they doing that? And so like, as the therapist who's done the work with them, like, first of all, we only heal through people, you know? And then second, you have to build trust with them, you know, which can be so challenging because they do not want to be your friend.
Right.
So you build trust
You have
with
to
them.
earn. You have to earn that trust.
Yeah.
Yeah.
And then once you do, I mean, for me as a therapist, I've just always shown up as a real person, you know, and always brought myself into the room, and been like, can you tell me what's going on? Like, and therapy is so much about listening to what they're saying, not in like the underlying message of them feeling invisible at home or, you know, neglected or feeling hurt, you know, and then helping them learn the language to say that back, you know, and that's how you can help adolescents is by teaching them the language of what's going on.
Right. And then, you know, the hope is that by doing that at that age, at least you prevent further, you know, addictions or suicide or other things. Because, I mean, one thing we've been hearing a lot about is kind of the dichotomy of, you know, or I don't know if it's dichotomy, but it's basically you hear on the news all about mental health. And then especially with the younger generation who's so involved in social media at an age where it's so easily to be influenced and they see all these kind of archetypes of what, you know, this is what you should have and this is what you should look like, but that's not reality, right? And that's not even the reality of that person who's putting that image out there. It's just the moment that they've created, that they've spent hours to perfect. But ultimately that's leading, and not that directly, but that type of engagement with social media and disassociation with reality is leading to suicidal thoughts and ultimately suicide. And then on the other hand, you have the fentanyl epidemic, and that's become paramount as far as addiction and the fatality related to it. I mean, before people did drugs and, you know, you would work with them, but now it's just one and done almost in some of these situations. So you don't have as much rope, you know, in that type of situation. Can you touch on, because you mentioned earlier trauma is a gateway to addiction. And so what is that process that you've seen people go from having to use drugs or alcohol to deal with this, and what are we trying to do to replace that, a healthy approach?
Yeah, so I mean, at one of the places I worked, I started to like see these themes with clients, and one of them was about attachment and their relationship to their caregiver. So they would have, like, I had a bunch of clients, they had all these like really critical moms, you know, that like emotional abuse, all this stuff. And I saw them all using heroin. And so I was like, why? why is it that one? And so as I like dove into it, and I would go, what do you like about heroin? And they would be like, it makes me feel comforted and warm and nurtured. And I went, there's the link.
Right.
They didn't get this from mom. And so they've been searching their entire life for this thing to fill them and make them feel that because they didn't get it. And then I saw with like meth users, I saw situational trauma where, you know, gang violence or shootings, and I saw how scared they were. And so to cope, they would use meth because it makes you feel strong and powerful. And they wouldn't feel scared of their trauma anymore. So they were these drugs to numb the traumatic pain that they had. And so they weren't, you know, healing through it. They were just numbing it and, you know, a replacement.
Got it.
Yeah.
Got it. And so what are techniques that, you know, in your sessions, both individually and also in the groups and different types of programming that we have, what are best practices and techniques to help individuals and families dealing with these types of traumas?
Yeah, I mean, it's all about safety. That's the number one rule with trauma is like make sure you're in a safe place to talk about it.
Got it.
Whether that be a group or with a therapist or with a partner or you know, a trusted friend, right? Because you can't work through those things if you are, you know, feeling your trauma in the room, right? And then it's really just allowing yourself to work through it and feel those emotions and have someone there that goes like, to remember, like, you're safe.
Right.
You're safe. Because what happens with trauma is you relive it. It could have been 10 years ago. And if I start talking about it, I'm going to have a physical reaction.
Got it.
And I won't be able to calm myself down, right? So that's why, you know, we have therapists and, you know, people to see that and go, like, take a deep breath. And grounding skills are the other thing that you do in therapy is you always teach people how to regulate their nervous system, so that they can get the space to calm themselves down and not flood, is what we would call it, or get so distressed that they go into a panic attack, basically.
Right.
You know?
No, I think that's important. I mean, at Ocean Rock, we have a multidisciplinary team to kind of deal with these different topics. So, you know, I think talk therapy by itself is effective for certain things, but when it comes to trauma and really issues dealing with high intense, you know, mental health and also substance abuse, it's the multiple angles that we deal with it, right? Which is, sure, you have the individual sessions, the talk therapy, the CBTs and DBTs, which we'll talk about, but it's really more than that. It's you know, group sessions. What's so good about it? Because a lot of people think, why would I want to be in a group session?
Yeah. That sounds terrifying.
Right?
That sounds horrible.
Like,
now
and
I have to.
how would that be effective in this type of situation, dealing with trauma?
Yeah, I mean, when you get to sit with other people that have similar experiences, you get the feeling that I'm not alone.
Got it.
Right? Trauma survivors always feel like I'm the only one. Like, no one understands what I'm going through. But in group therapy, you get to hear other people's stories and learn from them, and they go like, hey, this is what I did, and like, you're so strong, and that's what we need, right? Like I said, we heal through relationships, and so group therapy is one of those things.
And feeling like you can connect with people, and that's a good start, right? I mean, you talked about being in a relationship and being able to live life like that, but it starts with just connecting with the person sitting next to you. So that's one of the things that we really emphasize. And then what, you know, earlier you mentioned a technique called EMDR. What does EMDR stand for?
Okay, EMDR stands for eye movement desensitization and reprocessing. Very lengthy.
Very lengthy, but by short we call it EMDR. And for those who are not familiar with it, what is the actual process? What does it look like? Can kind of walk me through. Imagine if I was your client and I was going to be doing it.
Yeah, so if you have any negative cognition about yourself, whether I'm bad, I'm worthless, I'm unsafe, right? Because they geared this modality for trauma, but we've learned that you can use it for any negative cognition.
Okay.
So with a negative cognition, like you see your hand and imagine that's a neural pathway in your brain. So I am bad, I am bad, I am bad. It's been reinforced. So the process of EMDR is to help your brain create a new pathway.
Okay.
To say it's not that I am bad, it's I'm good enough. Right. So the process of EMDR, it's a 8-step protocol, but basically you do resourcing first, which is like making sure you have coping skills in place so you're stabilized. But then you use bilateral stimulation, which will, because trauma is not stored up here, it's not stored in the right filing cabinets. It got stored in your body. You don't even have words for it. So EMDR is not talk therapy. It's very much you sit back and you let your brain do the work. So they do bilateral stimulations either with the hand where you follow the fingers or use audio or tappers. And so you go through a protocol and you start with whatever the distressing memory is and you rate it 1 to 10, how distressing it was. And through the process, it becomes less distressing.
Okay.
So some people say it's kind of like exposure therapy because you're reliving the trauma, but after you do the bilateral stimulation, it gets reprocessed to where you go, it's not as distressing anymore. Whereas normal exposure therapy, you're just like forcing someone to deal with spiders and you're like, you know, but people walk away going, something changed. And it's because you created a new neural pathway in your brain to tell you something different.
Okay.
So sometimes it takes about like 10 to 12 sessions.
Okay.
But usually you can, you know, make that event be in the past and go like, yeah, that sucked. But when I remember it, I'm not in panic anymore.
Okay. And, 10 to 12 sessions, a lot of times people are in therapy, they're in therapy for years, right? And what are the normal techniques that are used in therapy compared to EMDR? And how, because what I've heard is EMDR is it's a lot of work, right? It's you go through a lot, but then it's also almost this accelerated path to where you need to be. And so, a lot of times people are looking for the quick fix. Now, this isn't a quick fix,
right,
but it's definitely, one EMDR session, is probably a lot more impactful than just one therapy session. So can you tell us a little bit about that concept of how the treatment works and how quickly or how impactful each session is?
Yeah, so I think you said it intensive. It is very intensive work. Like, we don't have people start EMDR who are not ready to do it because of how triggering it can be and how exhausting it is. Because really, every time you do a bilateral, your brain is jumping from when I was 4 to when I was 6 to when I was 7, and you go all of these places. So it's very exhaustive because your brain's doing a ton of work. So all of your brain can think faster than you can talk. Basically is the concept. So you can go all over the place and process all these things without having to talk about them. So clients will say, like, I feel like I did 10 sessions worth, of therapy in one. And
that's huge.
Yeah, and as the clinician, you're like, yeah, and I didn't even talk. I just helped walk you through the protocol.
You help them navigate through it, yeah. So that seems, something that I personally, if I was going to be going and seeking therapy, that would be a component that I would be interested in. I've actually tried it once, and I will tell you, I went into it just wanted to try it out because I was curious.
Yeah.
And it was very impactful. Yeah. And I was actually surprised, but I think one key important ingredient you said is that person, the therapist who's guiding you through that has to know what they're doing.
Yeah.
And so this isn't something that any therapist can do. Does it require some extra training and experience to be able to do it? Yeah,
you have to be trained in it and supervised, you know. So on top of being licensed, you have to do these additional steps to be able to do this protocol.
Got it.
You have to be, able to do it. And usually you have to do it yourself as well.
Right. And you said earlier you've actually done it as a client, and so you know what they're going through. It's not you're not just telling them, hey, do this. You've experienced it.
Yeah, I'm like, you're gonna be exhausted. I didn't have a filter. I was like, irritable. Like, so you're able to tell the client.
Even later at night, you might have these dreams and like how. And so I think part of that is, you said it earlier. You said they have to be ready for it, right? And so someone coming into these programs. There's some work to do before you get to that point. But ultimately, the goal is to get them ready if they are dealing with trauma, because as you mentioned, it's not just, based on logic and thinking and reasoning. It's this, you said it was stored in your body, right? And so this is a technique and a tool to kind of go in and bring some of these things out, but then also you have to then process and manage it. So, I think that's really effective. What are some other tools that you've used, and also whether it was for yourself or for your clients, to deal with trauma? Because again, if it's something that's stored and it's in the body, then how do you release that?
Yeah. There is a ton of research around yoga, and that being, a way to release what's stored in the body. You do acupuncture, there's, massages. And I think you would do all of that in conjunction with therapy.
It's the holistic nature of it, right?
But there are a ton of studies that show that just people that did like 10 weeks of yoga, and they rate their trauma symptoms, are much lower after. So there's something to be said about yoga and the body and exercising. I think therapy in itself was really like talk therapy. Sitting on a couch and, you're just up here, you're just
that's
talking.
what you see on TV. Right? Yeah.
But it misses the whole component of your whole being, right? Like it's not just in your head, like it's stored everywhere.
Right.
And so you need that whole approach, to really heal from things.
Got it. You mentioned exercise, right? And one thing I was thinking about is, we have a colleague who's a veteran, and when we were talking to him, because we work with veterans, and we always want to kind of create a custom program for them because they've gone through so much trauma, and they could have gone through it as childhood, but what's really impacting them is when they went to war, and just all the things that they saw and experienced, right? And so I actually want to talk about that population because that's such an important population in the United States and other countries. And these are people who went and risked their lives and, came back and they're wounded, and there's not a lot of support for them. And I think, we have programs that help, but when it comes to trauma and, the generic, I don't know if it's generic, but there's the term that they always use, PTSD. I think when you actually talk to the clients, they don't like that term. But what are, again, EMDR, but also what are techniques that really work with veterans? And, just like when we have the kids and, we don't know how to deal with them. I think veterans is another population where everyone wants to, let's standing ovations and this and that. But at the end of the day, what are the resources that we can give them when they come back, and how can we help them integrate back into society and deal with all the pain and suffering that they're going through?
Yeah. And I mean, I'm not an expert by all means, but in talking to our colleague, like it really sounded like having the language for it was really important to him.
Right.
Because in his specific traumas, like they use different language. They're taught to know feelings, suppress it, like show strength. And so there's a different, discussion with veterans about vulnerability, and which means on the clinician's end, creating a safe space for just them, right? Because again, like we said with groups, like people feel alone and they feel like they're the only one that has gone through it. And so most of the time people are isolated, and when we can get them all together talking, they can start to, be comfortable to share it and not feel alone.
Right.
And then he really talked about exercise too as the thing that saved him. Like he had to work it out of his body almost. And then he also really highlighted breath works,
Right.
And that breathing component and that regulation and learning, this new way to kind of cope and experience his feelings in his body.
Got it.
Yeah.
You mentioned breathworks. What is breathworks, what exactly is that?
Yeah, it's different types of breathing, and they pair it with music at times.
Okay.
And it's to help kind of reprocess feelings. I think they do prompts. I really haven't been in a breathworks,
Right.
but
I've tried it a few times. So I think it's exactly that, but it's basically, there's this component of giving up control because you have an instructor and they're telling you what to do, right? And I think that's part of it is just listening to that person, and then you go through the breathing exercises, and as you change your breathing techniques and you kind of follow the instruction, you'll actually physically experience change, right? And so and it's impactful because it might be uncomfortable,
right?
There's a certain uncomfortability to it, but once you get past that, that's when the healing starts. And I think with any of these things, I think the common denominator is, if you want to completely avoid dealing with this stuff, then you numb yourself, you do the drugs, you do all that. But if you are sick of that, or if you don't want to die and you don't want to continue that path to just rock bottom, or if you've been there and you want to crawl yourself back, you can't just do one thing, right? It's because people are saying, I'm just going to exercise. Well, that does a lot. Exercise is huge, but you also need to process your feelings and go through the emotions. But then you also need that group connectivity, whether it's in AA groups or it's in therapy groups, or a combination of those where you can connect with people and build those relationships and feel safe. And then there's what you talked about, which is breathworks, EMDR, which are actual techniques that people can guide you through that will ultimately get that physical, storage of these
Right,
negative
right.
feelings and thoughts out of your system. And then it's about repetition, right? It's
Yeah.
about consistency. And so, I mean, I think that's what's great about both Ocean Rock as a virtual outpatient program, because we can work with them while they're at home. But then also, you know, whether it's a, you know, residential facility or a 30-day inpatient, that's when you build the foundation. So then later when you continue, you can carry it on. But you can't stop. I mean, you have to, just like we eat every day and we breathe every day, you have to use these techniques. You know, what I think I want to really go back to your own story, kind of circle back. And you mentioned you've tried different things, but what is it that you do on a day-to-day basis, and what are the and I mean, not obviously we're not all perfect, right? I think good enough was really a good phrase that came out of this, is we don't have to be perfect. But we're not bad, and we just have to strive to be good enough. But what do you do to manage all the things that you've gone through before and helping you move forward?
Yeah. That's a good question. It's probably a lot. I mean, I've been in.
I mean, you've touched on all of it, but I
Yeah.
just want to kind of.
Yeah,
you know,
I mean,
for you to share
day-to-day
that.
basis is, you know, it is being active. You know, I have seen like working out has really helped to relieve some of that. My sleep's still bad. But really just trying, you know, to practice mindfulness in my life, and trying to be aware of where things are coming from.
Got
you
it.
know, I still have reactions. I still have bad responses to things. But if I can slow myself down and be mindful of like, okay, and really it is identifying like what's going on in my body when I'm having a reaction, because usually I can feel it. I either turn red right here or I feel sick to my stomach. And that is the key that my trauma is being triggered. And because of all the work I've done, I can see it when it's happening and either ask for what I need, you know, from my partner and go, hey, I need you to help soothe me right now, you know, going back to even that attachment model. Or I need to go for a walk and be by myself, or, you know, even walking is that bilateral stimulation, right? So that is, you know, EMDR in of itself.
Right? Yeah.
So it's really being mindful, and then using the tools that I've learned to help regulate my body and my parasympathetic system and calm it down. Because, I mean, we all have that. You know, if someone cuts you off, your heart races, right?
Right.
But you can usually, like, regulate.
Right.
Someone with trauma stays in that state.
Right.
And then has to go, well, what do I do with this?
And then they spiral down. You mentioned something that I think is one of the most important things when it comes to anyone dealing with mental health or addiction, is identifying when you're going through these feelings, and more importantly, reaching out for help, right? And I think that's when you succeed, because we have clients who they might relapse, or they might, you know, have multiple attempts at recovery. But ultimately, the ones that get it are the people who ultimately learn to identify, you know, before they take that step, and then reach out for help, and not feel that shame and all those other feelings that go associated with, well, you know, I did all this work and I have all these days sober, I've done all this therapy, and I can't believe I'm back here. It's like, it's okay to call your therapist or call somebody in your, you know, your sponsor or your parents or whoever it is, right? And whoever you feel that whoever you've built that safe relationship with, right? And that's why it's important to build those safe relationships, because regardless of what's going on, you know, on the outside, you have that one person that you can talk to, and sometimes it's that one person and that one call that saves your life. So what are some things that you can maybe help the listener and the viewer, if they are somebody who's dealing with a loved one who has mental health, addiction, trauma, and they know that that person has it, and, you know, they've been part of that process with them, but what can they see to identify that, you know, I need to help this person? Because a lot of times what I hear is, you know, oh, you know, let's just say, you know, Allyson was just didn't want to talk. She didn't want to feel, didn't feel like talking, or she just said, I need a break. And I wanted to honor that. Right. And I mean, I think that's good in general, to give people space. But when you're dealing with somebody who has, addiction or trauma, and they're working every day to stay sober, to stay healthy, leaving them alone is not a great idea, right?
Yes.
So can you tell me a little bit about that? And we can really wrap up with that, because I think a lot of people want to know, is there anything I could have seen or heard that I should have, done more? Because a lot of times it's too late, and then they're looking back, and maybe there's one thing that they hear that they can actually help prevent a bad situation.
Yeah, I mean, I think, for people that support anyone with substance abuse or mental health, like, that's always going to be the question, like, is there something I could have done? Right. So I just want to say, like, probably not,
Right.
But in being a safe person, not being judgmental, critical, and really just giving people space to listen, like, hey, I'm here for you when you want to talk, like, and I'll just listen, like, no advice, nothing. That's what we need as people, struggling. And then making sure to point them in the right direction of a trained professional, because, we might not know the right thing to say, and they might be dumping their trauma on us, and we're like, we might say the wrong thing, So making sure they have the support in place, but just, making sure that people don't feel alone. That's the biggest thing. That's where, suicide rates are so high, and substance abuse, like, people feel misunderstood, and if we can listen and go, like, you're not the only one, I might not fully understand it, but I'm here for you. I think that changes things.
Got it.
Yeah.
All right, Allyson, it was a pleasure having you here today, and I think we learned a lot. I think we learned a lot about your background and your experience, and also just such an important topic, because I think people don't recognize that, because it's just something that could have happened earlier on. It's something that happens throughout your life. But to be able to use you as an example of somebody who went through it, but also was able to do the work, and now you have relationships at work, you have relationships at home, and it's just great hope for anyone dealing with these types of situations. So thank you again.
Yeah, thanks for having me.
All right.